Hey everyone, this is Rupa. I'm one of the internal medicine residents at the Cleveland Clinic main campus. Today I'm going to be discussing about how to basically present a progress note. You have seen the patient with diarrhea, now you have to present that case maybe like 2 days later. Okay, how would you do that? For progress note, every hospital has a templated notes and you can just write whatever you need to write on the templated notes. But for progress note, how to present, so presentation of progress note is slightly different from HNP because you're attending knows the patient, you don't need to present everything. Okay, so what you need to present is the first is one liner to remind the attending which patients you are talking about. For example, this 27-year-old dude with colon cancer on chemo present with diarrhea, now on antidiarrheal and IP fluid, getting better. That's it, nothing extra. Interval events. Next, you have to say interval overnight. What happened overnight? Nothing happened overnight. He's fine, or maybe he had some hypotensive episodes overnight, or her had some chest pain, or had some shortness of breath. Whatever, you have to mention those, and then you say, okay, pertinent morning labs, or pertinent for probably white count is like white count is declining. For example, like went from 20 to 15. So that's it. So you see, like white count is improving, and AKI is also improving with the creatinine up, for example, was 1.14, now is 1.08, which is near baseline. And then you say, okay, we did a CT scan, whatever, if anything. Then you say any new exam finding. If you don't have any exam finding, you say no changes in physical exam, or you say okay, there is new guarding or rigidity or whatever. Okay, that's it. You don't need to reiterate the physical exam finding again and then lab finding again and again and again. Next, you go to assessment and plan. You said, okay, problem one, we had problem one, diarrhea, getting better or not. For example, the guy is getting better on IVF, on kind of like anti-diarrheal. You say, okay, he's getting better, we don't need to change anything. We started him some, for example, 150 ml per hour IV fluid. Now that he's been getting better, we can just come down to 100 ml per hour. And you usually calculate the maintenance IV fluid based on the weight. Okay, and then that's it. For example, he's not getting better on diarrhea, then you say, okay, he's not getting better on diarrhea, we are giving him a maximum dose of loperamide, and then you say, okay, we can change it to another thing, we have low motil, another medication. You can say, okay, we can start those. That's it. And problem two is AKI is getting better or not. If it's not getting better, then what you do? If it's getting better, then just continue those, or if you want to de-escalate the treatment, that's fine too. Then third problem is on the type 1 diabetes. You don't need to say, okay, he has type 1 diabetes, was on insulin. You don't need to say all of this. You said, okay, he has type 1 diabetes, now we're continuing insulin. That's it. Nothing else at all. Okay, have fun. Bye bye.